Hello everyone, so today with the help of Ethan and Keirin, we'll be discussing an article on the pharmacokinetic profile and the occurrence of visual hallucination in patients with sporadic Parkinson's disease. So with our chosen article, it primarily focuses on the association of various anti-Parkinson's drugs with the occurrence of visual hallucination, such as levodopa. It is a dopamine precursor that effectively treats Parkinson's, as its adverse effect is visual hallucination. So to proceed with our presentation, why did we choose this article? This article explores various anti-Parkinson drugs with the occurrence of visual hallucination in relation to different genotypes of the dopamine receptors. It also further explores the correlation between dopaminergic treatment with the occurrence of visual hallucination.
Parkinson's disease, or PD for short, is characterized by the degeneration of dopaminergic neurons, resulting in motor symptoms such as tremors and rigidity of movement, and affects up to 1% of people aged 65 plus. People under 50 years of age can show early onset of the disease, with 1 in 308 Australians living with Parkinson's. Studies have shown that roughly 50% of patients with a confirmed diagnosis of Parkinson's have had an account of visual hallucinations, a non-motor symptom of Parkinson's. Treatment for Parkinson's, like levodopa or L-dopa, is a prodrug which converts to dopamine once crossing the blood-brain barrier, effectively reduces these negative Parkinson's symptoms. However, visual hallucinations remain prevalent amongst patients on treatment, with 22 to 38% of patients on L-dopa exhibiting visual hallucinations. L-dopa treatment and visual hallucination symptoms both separately attribute to an increase in mortality amongst Parkinson's patients. Visual hallucinations brought on by Parkinson's are generally treated with antipsychotic drugs. Unfortunately, such drugs can worsen the motor symptoms present with Parkinson's, presenting doctors that have to prescribe L-dopa with a problem. Hence, the chosen article explores different associations between visual hallucination occurrence in patients on L-dopa treatment and their genetic variations of dopamine receptors. This article further draws on existing literature to understand the relationship between genetics and response to L-dopa, plus the associations between prolonged levodopa therapy and longer disease duration, attributing to higher frequencies of visual hallucinations.
Our study observed 224 Parkinson's disease patients from Brazil in a cross-sectional study, and what they found was that this particular genotype of the dopamine receptor was positively associated with increased visual hallucination frequency. Furthermore, they found that the use of MALB inhibitors, retigotine, and rasagiline were also associated with an increased risk of visual hallucinations. On the contrary, however, they found that the use of entacapone and amantadine had a protective effect against the occurrence of visual hallucinations. A study had established that dopaminergic therapy was positively associated with increased prevalence ratios of visual hallucinations. Retigotine, rasagiline, levodopa, amantadine, and entacapone are all drugs that increase dopaminergic activity in the brain via differing mechanisms of action. Despite this, however, some of these drugs are positively associated with increased prevalence ratios of visual hallucinations, while others have a protective effect. A plausible theory for the increased prevalence ratios of visual hallucinations during dopaminergic treatment is the dopamine theory of schizophrenia, in which excess dopaminergic activity can lead to psychotic side effects, in which visual hallucinations are one of them. Another study found that dopamine precursors, dopamine receptor agonists, and MALB inhibitors were strongly linked to the development of visual hallucinations, which corroborates our current study. Entacapone and amantadine, however, do not belong in the drug classes mentioned, and thus can explain their protective effect in visual hallucination frequency. The inconsistencies in the literature demand further research to evaluate the different drug classes used in anti-Parkinsonian treatment, especially in their capacity to directly cause or act as precipitating factors in visual hallucinations. This is important because visual hallucinations are highly detrimental to the quality of life and are associated with increased mortality in Parkinson's disease patients.